Gary, one question on my calls with clients that I keep getting is, what are the specific OTC monograph drug listing changes that we need to be concerned about?
Yeah, what do I really need to do, right?
Yep, exactly.
So that is a real good question. So I did kind of put this into two different areas. First, there needs to be changes to the drug data elements. The changes that we're talking about are definitely going to affect two of those data elements, the marking category and your application number and citation. I think there might be some in the audience that might use the citation, like the part number, in some other documentation. I don't know if you would use that in your patient information or some other documents to the FDA. But be aware that if that shows up on an annual report or something, that could be another touch point that you'll need to make sure you check off. So any references to the parts are now obsolete. But what we're focusing on today would be the actual SPL drug listing that you send in to the FDA for your product. And the data elements of the marketing category and the application number are the two that are affected with this particular discussion. You may have been using the OTC Monograph Final and the OTC Monograph Not Final particular marketing category. And those two are now retired. So they're deprecated. You can no longer use those. They're no longer valid. And both of those are now replaced by the one on the right-hand side here, the OTC Monograph drug. So that is now showing on the SPL resource webpage. It's part of the validation rules. So if you do submit a OTC Monograph drug listing, these will be rejected and the OTC Monograph drug will be accepted. There is one other category that I just wanted to highlight, and it's this one here about the drug product manufactured under contract. So that particular category, it's still used, it's still valid, but you might have been using a CFR citation to a part number in this particular SPL. So we'll go into those changes next, but that particular marketing category is still valid, old and new. But be aware that let's talk now about the application number. So if you were using an antacid product, you would be referencing citation, part 331 of the CFR. That has now been replaced with the monograph number M001. And then as another example, part 352 for a sunscreen drug product, now that references M020. And it goes on and on. There's about 30 of these particular parts. We charted them here in the next few slides. Let's take a quick cruise through those. We're not going to spend any time on those, but you can find your part number in the second column and the corresponding OTC monograph number on the left-hand column, and we'll just work our way through page 2 and page 3. Now we're at the bottom. There's one that I want to highlight, and it's this one down here on the bottom, NM900. And that caught my eye. It's like, wait a minute, that looks like a different format than all the others. And sure enough, it points to a different type of entry in this list. This includes something called non-monograph conditions. So it's a kind of a catch-all of a number of ingredients that have been used in OTC products that the FDA indicates does not have sufficient evidence to be safe and effective. So you might want to take a look at that particular item. You can go to this OTC Monograph website and find this NM900, and it has a live link, and you can download some information about it. It's one thing that if I was an OTC manufacturer, I'd want to take a quick look at to make sure that some of these products that are now not to be used, to make sure that they're not on my ingredient list, and therefore it could be problematic going forward. But those are the the 32 or so monograph numbers that you should be aware of. And this is dynamic, so there's others in the works, and the FDA certainly can add these as they see fit.